welcome to InfoHub. In our headlines, Guyana stands in solidarity with disaster-affected Mexico and Dominica as preparations are underway to aid hurricane-affected islands. GuySuCo to get $2 billion bailout in exchange for lands. Festival City Health Center as well as New Amsterdam Hospital to receive upgrades, and project launched to improve education sector. Stay tuned for the details of these and more. Thanks for staying tuned. And now for the details. Guyana stands in solidarity with the government and people of Mexico and Dominica following the devastation caused by the recent natural disasters, which resulted in the loss of life and extensive damage to property. Guyana is committed to and stands ready to assist these countries as they endeavor to return to some level of normalcy, while recognizing that this process will take time and resources. Guyana extends its deepest condolence and prayers at this difficult time, especially to the relatives and friends of those who have lost their lives. Guyana's preparation to aid hurricane-stricken Caribbean territories is well underway. Zanil Williams has this report.
Guyana has started the process of lending aid to Caribbean territories that were affected by Hurricanes Irma, Jose, and Maria. The territories include Antigua and Barbuda, St. Martin, and the British Virgin Islands.
The government of Guyana has established a ministerial task force headed by the Prime Minister with assigned responsibility of coordinating the national effort towards offering humanitarian aid and solidarity to the affected Caribbean islands.
At a post-cabinet press briefing earlier today, Minister of State Joseph Harmon reiterated that the government will be donating $100,000 to the Caribbean Disaster Management Agency Fund. The needs assessment team first arrived on the island of Antigua on Sunday, September 17th. The delegation, which was led by Minister of Citizenship Winston Felix, explained that items are set to arrive the same day, after which it will be distributed to other territories. Later that day, an aircraft arrived in Antigua with medical, sanitary, and food supplies. An initial batch of 10 containers filled with building materials and additional food, medical, and sanitary supplies will soon be airlifted to Antigua in a C-130 Hercules. This will be provided by the British High Commission. Minister Felix explained that though the visit was organized well, it was hampered by curfews in place. 2 bank accounts have been activated at GBTI and Republic Bank to facilitate donations from the public. A telethon will be hosted on NCN from 8 p.m. to 10 p.m. on Saturday, September 23rd. Locally, several communities were adversely affected by storm conditions. Prime Minister Moses Nagamutu, who is acting in the capacity as president, will head to Bat Settlement on Friday, September 22nd to have a first-hand look at the affected areas. Zanil Williams for InfoHub.
The government of Guyana will offer GuySuCo a $2 billion bailout in exchange for lands for the Central Housing and Planning Authority. This was announced by Minister of State Joseph Harmon at his post-cabinet press briefing today. Minister Harmon explained that Cabinet was briefed by Minister within the Ministry of Finance, Jaipal Sharma, on the financial situation at GuySuCo. Cabinet has considered the report and has further authorized the minister to assist the management of GuySuCo with their ongoing discussions with the Central Housing and Planning Authority. The agreement will finalize the sale of land and facilitate payments for such lands urgently. UNAIDS announced a breakthrough pricing agreement to make the first affordable single-pill HIV treatment regimen available to public sector purchasers in low- and middle-income countries. Tiffany Rodias has this groundbreaking report.
The affordable generic pill will be made available to 92 countries in an accelerated treatment rollout as part of efforts to reach the 36.7 million people living with HIV. The treatment DTG, which is widely used in high-income countries, is expected to lower the cost of first-line HIV treatment regimens.
Those people will benefit from one of the best medicine we have as a first line. What we are talking about today with this life-changing announcement is about the quality of medicine, but is about equity, is about dignity, is about access to medicine as a human right.
DTG is one pill once a day fixed dose treatment that will be initially launched in South Africa but will be available to low and middle income countries like Guyana in 2018. Reporting from the United Nations in New York for InfoHub, Tiffany Rogers.
The Guyana Education Sector Improvement Project was recently launched to close disparities among schools. Here is Delicia Haynes with this report.
The GESIP project, designed to re-engineer local education from nursery to university levels, was launched on Thursday at the National Center for Educational Resource Development. Education Minister Nicholas Henry spoke of the project's crucial nature, which is in keeping with this year's education theme.
This theme should resonate with all of us as we move forward boldly with our education agenda, which embraces research, consultations, and policy strengthening to put into action one of the most comprehensive changes we will experience in Guyana's education history.
The minister said she believes that the education system has to be engineered to suit all Guyanese.
It is for that reason that the Ministry of Education has re-engineered the system so that we can produce a new framework that will give every child, no matter where they are from or what they look like, the chance to be educated to their full potential.
According to Senior Education Specialist and World Bank Representative Hong Yu Yang, the initiative was possible through a collaborative effort between the Government of Guyana via the Ministry of Education and the World Bank. Highlighting the project's objectives, Chief Education Officer Marcel Hudson disclosed that work has begun in several areas. These include a review of the education curriculum, the delivery of technical and vocational education, and the intense training of teachers. Students at the nursery, primary, secondary, and tertiary levels are expected to benefit from the program. Delicia Haynes for InfoHub.
Gabriela Patram now tells us that the Ministry of Public Health and the Mayor and City Council are working to improve services at the Festival City Health Center.
The minister within the Ministry of Public Health, Dr. Karen Cummins, heading a team of officials, conducted a site visit to Festival City Health Center. The minister explained that the visit's purpose was part of efforts to integrally craft a way to improve the facility's services.
We would like it to come up to on par with some of our facilities that we have at the Ministry of Public Health. And so we are prepared to partner with the City Council to ensure that we deliver quality care to the citizens of South Georgetown.
The issue of flooding around the health center was one that was immediately addressed.
Starting from outside, as you know, this place floods very easily when rain falls. So we're working, we have two engineers, one Mr. Kelman from the City Council and our own Narish from the Ministry of Public Health. So they'll work together with Ministry of Infrastructure and see how we can improve the situation.
Chief Health Visitor Medics Beres Springer said that the MNCC is interested in the health and well-being of the people in and around Georgetown, hence their approach to the Public Health Ministry.
To extend the services as well as the building, we'll be making like a one-stop shop where you can come and see a doctor, your medication, and have everything done. So we're looking forward for that, where the people from this community won't have to go to Georgetown Hospital. So at the same time, we're easing the workload at Georgetown Hospital, so Georgetown Hospital will be able to tend to emergencies as they should.
Similar visits were also made to facilities at Agricola, Lodge, and Sophia. The two agencies have committed towards addressing challenges and improving services within the shortest possible time. Gabriela Patram for InfoHub.
Minister of Public Telecommunications Catherine Hughes on Wednesday handed over a quantity of chairs to the University of Guyana and Theatre Guild. The chairs were reallocated from the Arthur Chang Conference Center, which is currently being renovated. Here again is Gabriela Patram.
Minister Hughes said that a decision was made to donate the chairs that would no longer be needed at the center. The ACCC is being rehabilitated by the government of the People's Republic of China.
Because of the renovation there, we realized that we had all the chairs that were in the conference, the main foyer, the main conference room, that were now going to be available because a new set of chairs were coming as part of the funding and rebuilding from the Chinese government. So what we decided we wanted to do is to give those chairs to two organizations.
The 275 chairs will be used to upgrade the students' lounge, some will be installed in classrooms, and the remainder will be placed in the Center for Communication Studies. Vice Chancellor and Principal of the University of Guyana, Professor Dr. Ivelaw Griffith, received the chairs, while Deputy Vice Chancellor of Philanthropy, Alumni and Civic Engagement, Dr. Paloma Mohammed, thanked Minister Hughes for the donation. Additionally, 100 chairs were donated to the Theatre Guild. Board member Malcolm De Freitas observed that the chairs will improve seating capacity as well as the ambience.
We are grateful to the government for supporting us in this year, and we are hopeful that they will support us in many other endeavors.
The Arthur Chang Conference Center rehabilitation is on schedule and is expected to formally reopen in May of 2018. Gabriela Patram for InfoHub.
Security in Berbice, Region 6 is well under control, according to Assistant Commissioner and Acting Crime Chief Paul Williams. Paul McAdam has the details.
Acting Crime Chief Paul Williams for the Guyana Police Force recalled that since taking over B Division in July, the force's ranks have been effectively handling the crime situation in the region. This, he says, included all serious crimes.
What we want to say is that we were able to be on top of the crime situation. All of the crimes, serious crimes that would have committed on our watch, we have solved them. Okay, we had like about 5 robberies. They have been solved. We had 4 murders, but then out of the 4 murders, there were 5 deaths because they had a businessman and his wife, and all are being solved. And then today, there isn't much in terms of really any serious crime.
The senior police officer pointed out that it would not have been possible without tremendous support from members of the community.
Also, we seek to have the engagement in terms of members of the community in our outreach. So they themselves are, helping us with certain information. And then more so, we're not really just focusing in terms of what we really and truly know as it relates to policing. We are working very close with the community in terms of helping them to deal with the challenges that they are facing. Because we know generally what policing entails. But then it's good enough for me to know exactly what are the root cause of the problems within the community. So that of itself can help us to be on top of the situation.
Williams noted that aside from collaborating with residents, the force also has a good working relationship with the region's business community. The acting crime chief believes that this collaboration with the people is the most effective way to tackle crime. Paul McAdam for InfoHub.
More efforts underway to improve healthcare delivery at the New Amsterdam Regional Hospital. This is according to Regional Chairman Parmal Armagon. Delicia Haynes has this report.
The regional chairman disclosed that among the health development projects, a new accident and emergency department is slated to be opened, pending the completion of ongoing works and the construction of a new maternity wing. There are also plans to build a theater at the Skeldon Hospital. Armagon said there have been problems surrounding the establishment of a health center at the number 77 village. This occurred after the regional administration initially chose to use the additional space of the recreational ground in the area. However, the residents refused the proposal, stating that they had other plans for the recreational ground.
They didn't want a health center in the playground because they said very clearly to us they have big plans for their playground. They want to put in 2 pavilions.
According to the RC, the residents informed the Civil Defense Commission of their plans. He explained that currently the regional administration is scouting for another location to erect the health center. The assistance of the Ministry of Communities was also sought to locate a vacant lot.
If we don't get that, then we will do the health center in the number 76 area. So one way or the other, that's going to be, that contract has already been awarded, but the contractor is waiting the location as to where that health center has to be put down.
Region 6 was approved $6.1 billion during the National Assembly for the 2017 budget. $2.8 million was catered for healthcare delivery. Delicia Haynes for InfoHub.
Thanks for watching. Remember to connect with us 24/7 on our website and social media. Goodbye.